Tanisha Washington,
Hi.
how your weekend been?
It's going good so far.
Yeah,
How's your?
my weekend is good. I have you here today, and we
Yes.
go. So let's.
Yeah,
You ready to jump into it?
let's go for it.
All right, here we go. So everybody, they know who I am. I'm Rob Regan, owner of Synergy Home Care of Lakewood. We cover Lakewood, Cerritos, La Palma, Artesia, Hawaiian Gardens, Rossmore, Los Alamitos, Cypress, Brandon Park, and Long Beach, zip code 90808. Today we're talking about their neurologic physical therapy. Tanisha here,
Mhm,
doctor of physical therapy. She working at specialized field. She working at the
mhm.
VA here in Long Beach. So thank you for coming on today, Tanisha.
You're welcome.
So to introduce yourself, tell people, how did you get into physical therapy? What made you want to get into that career field? And was it like a aspiring like actress they wanted to do it since they were like their adolescent years, or is this something that grew on you as you went into college or high school?
Yeah. So, I mean, growing up, I always knew I wanted to go into healthcare. I was always an active person. I grew up as a dancer and a cheerleader. So, most physical therapists, we all tend to be like former athletes or some sort of personality type of a thing. So, I always knew I wanted to do something in the medical field, but I didn't know quite what. And actually, my aunt, who is a social worker, she works with a lot of physical therapists. She said, I think you would be a great physical therapist. And so, kind of did a little bit more research on like what a physical therapist is and thought, yeah, that sounds like a good career path for me, and went into college and I interned at the physical therapy clinic at the campus health center. I also did a couple internships at the hospital nearby. I worked with the football team as well, in all of this in college, and then applied to physical therapy school, got in. Through physical therapy school, you have to do a certain number of internships in a number of different settings. For those people who don't know, physical therapy, we have 10 different specialties that you could specialize in with physical therapy. So I initially, like a lot of people, went in thinking I was going to be more orthopedic, maybe sports related. And that's why you do internships. I did an internship in sports, hated it, and then actually went the opposite way. I liked the neurologic physical therapy classes that I was taking in school, decided to do a couple of neurologic physical therapy internships, loved it, and 13 years later, this is what I do.
What school did you go to? What college did you attend?
So my undergrad I did at University of Arizona in Tucson, and then my physical therapy school I went to Loma Linda University.
That's a great university. And you said you worked with that
Thank you.
football team, right?
Well, my internship was in Phoenix working with the Arizona Cardinals, actually.
Okay. Were they any good back then?
Back then,
Oh,
no.
okay. So what made you go into that specialized field in neurologic physical therapy?
Like I said, I did two internships in neurologic PT, one inpatient at the VA hospital, one outpatient at Long Beach Memorial. This was like 12 years ago back then when I did those. And usually you do about 12 weeks in each setting. I picked those mainly because I really liked my neurologic physical therapy classes at the time and thought, oh, well, let's see, how it goes, like treating. And as I did those internships, I really, really felt like I had a good experience with that patient
Right.
population. When I got out of school, I actually worked at an outpatient orthopedic clinic just because I just needed a job like when I first got out of physical therapy school. So I, worked just the normal like orthopedic like outpatient clinic. And then when I was approached by the VA hospital where I had done my internship a year prior, they had really liked my work there and they wanted to bring on someone who specialized more in neurologic physical therapy. Even though I was a new grad, they invested in me, and 13 years later, I now am the mentor of the neurologic physical therapy residency program that we have at the VA hospital in Long Beach,
Let's go. Taking care of those vets.
and educating the next generation of specialists in neuro
Oh,
PT as well. So,
okay. There you go. So for a lot of people, including myself, listening in, what in the most simplest way, what is neurologic physical therapy?
so like I said, we have a number of different specialties with physical therapy. So when you hear physical therapy, you think, oh, your typical rehab from an injury, which, yes, that is the case. But for patients with a neurologic condition like stroke or Parkinson's, MS, spinal cord injury, traumatic brain injury, vestibular balance disorders, those are considered your neurologic disorders. And so those are special diagnoses that I would tend to work with or that a neuro PT would work with. So we would focus more on things related to those specific conditions. Instead of giving you general exercises, we're going to go more targeted, specific, activity specific things that we'll kind of focus more on instead of your general, like, do 10 of these squats or do 30 of these heel raises. We're going to go more function based, is what I'll say.
Right. And that's great. So, me being in this space, in the non medical space, I deal with clients with Parkinson's, with clients who had a stroke, recovering from a stroke. So, I
Mhm.
want to touch on that a little bit more for educational purposes. Also, at fall risk, we mentioned having a neural problem, the imbalances are not there quite yet, right? So, what are some of the most common neurologic conditions you treat, and how can physical therapy help the clients recover from, say, for example, what we talked about, having a stroke? Their balance is going to be off. Parkinson, can you just elaborate a little bit more for that family out there that's listening, saying, yes, my husband just had a stroke?
Yeah. So as far as your rehab goes for your neurologic disorders, it really depends on what the disorder is. Ideally, you would have already seen a neurologist and they hopefully would have recommended rehab or therapy, but not all neurologists actually think to go straight to physical therapy. As a physical therapist, I do recommend that every person with a neurologic condition does see some sort of physical therapist to work on their mobility because there's always something you can be doing. It does help to have a professional look at those things. When we're looking at rehab from a stroke, it's very time sensitive, actually. Within the first year of a stroke, rehab is very important for those patients. That's your window of time where you're going to see the most recovery, if any, it's a spectrum of things that happen with the stroke. Not every stroke is going to look the same. For some people, you're going to really truly see that recovery. For other people, it depends on the severity of the stroke, and you may not get that full recovery. But that's why we say that first year is the most important, where you really want to make sure that they're involved in some sort of a rehab process to see what we can recover. For your other disorders that are more progressive, like an MS or Parkinson's, those are what we call progressive neurologic disorders. And so we treat those a little different in the sense that we focus more on maintenance therapy with those types of patients, in the sense that we're trying to preserve the mobility that you have and maintain what you have, trying to slow the progression of the disease process, ideally.
Okay, that's great. So, learning this and reiterate what you just said, that 1 year mark, that family need to go see a physical therapist, but more so their neuro doctor, right? And hopefully, like you said, that doctor, neuro doctor, prescribe some PT sessions. And for the quality of care, I'm assuming. So,
Mhm.
what's the how do you differentiate a neuro physical therapist versus a general physical therapist? What's the difference between the two?
So, depending on what type of insurance you have, they're going to kind of have their network of people that they send you to, kind of a thing, too. There are a number of different, like, outpatient physical therapy clinics. And yes, any physical therapist technically can treat a neurologic condition. As a neuro PT, I would recommend that you go towards a clinic that specializes just in neurologic conditions, just because that is what they see all the time. And from my, like, being biased, we see that all the time. We kind of know what targeted interventions to use versus maybe someone who may see a stroke patient or a Parkinson's patient here and there mixed in with their general orthopedic patients. Kind of. At the VA, we have our clinics already set up to where they're separated. Our patients are separated by diagnosis. When you're on the outside or when you're in the private sector, it's usually going to be more insurance based. So you may have to do a little bit of research on your own to see what neurologic physical therapy clinics are in your area and to see if those are in network as well.
For sure. So again, I want to talk more about strokes and Parkinson. Can you walk us through what's the typical physical therapy session? Let's just say again, dealing with somebody who just recovered from a stroke or who is recovering from a stroke and or who has Parkinson. What's their typical PT session?
So, assuming we're talking about outpatient physical therapy, that's my area. I should have said that before too. I work outpatient neurologic physical therapy, but there's also inpatient rehab as well too. That's going to be your initial physical therapy that you get after an injury or immediately after a stroke. So if we're talking about a stroke patient, ideally would have been admitted to a hospital. And if they decide rehab is indicated for this patient, there should be some sort of a rehab assessment as well. And then you would do your stint of rehab as an inpatient usually. And then that may span a couple days to a couple weeks to a couple months, depending on the extent of the stroke. Once that is done, the other level that you could possibly go to is home health physical therapy. So typically with home health physical therapy, you will have a home health therapist that comes to your house and they're going to assist you with things that you do around your house, ideally like transferring from one surface to the next, bed to chair to toilet, that sort of a thing, maybe working on walking, and then hopefully getting you to a point where you can go to outpatient physical therapy. So then once you come here to an outpatient physical therapist, typically we would do an assessment of your functional mobility. How do you do those same things that you do at home? How do you transfer in and out of bed? How do you transfer, from sitting to standing? Can you walk, kind of a thing? If you're ambulatory, what does your balance look like then? And also looking at any other range of motion or strength or coordination deficits. That's going to be your typical evaluation. And then your treatment sessions, your follow-up sessions are going to depend on what impairments we found in that initial assessment. And that's going to dictate what your follow-up sessions would look like. For your Parkinson's patients, this is, remember, a progressive disorder. So you're not necessarily maybe going to go into an inpatient setting unless something happened, like you had a fall and you injured something. But typically you have a diagnosis of Parkinson's and maybe you're displaying some of the cardinal signs of like freezing or of like tremoring, where you actually get like shaking. A lot of people, tremors of the hands are the first things that you start to see. Slow movement, small movement, freezing up, different things that you might notice with your mobility. And so then the neurologist ideally would then send you to a physical therapist like myself. We would, again, similar type of an assessment, balance, range of motion, strength, coordination. We would look at those things. And then again, your treatment session is going to be kind of dependent on what impairments we found, because for whether it's a stroke, whether it's Parkinson's, you're going to have a spectrum of like deficit. Not every patient's going to look the same, but we always want to focus, like I was saying before, on targeted functional specific activities that you would do at home per se too, and working on those things in the session.
Right. So let's give the audience some practical advice. What are some signs a family should look for that may indicate they could benefit from a neurologic physical therapy session? So if I'm at home and say my mother is she's in my house, what are some signs that I can identify or behoove me to learn that, okay, she has some type of neurological situation going on up there? Can you elaborate or just keep it simple and not indulge into your methodology of the medical, all that terminology you guys like to use, but for basic practice sense and just for practical advice, what can you say for that family and some small indicators that they could benefit from?
So the first thing I would say is let's break it down just for a second, because with neuro PT, there's so many different neurologic disorders. Assuming you've had a neurologist and they've already diagnosed you with a certain neurologic condition, then you would look for either worsening of function, decline in function, decline in mobility. Like if they were ambulatory, now they're not able to walk as much, or they're getting tired more, or loss of balance. This can go for someone with a neurologic condition or just with general deconditioning as well, decline in function, losses of balance. fall, the four-letter F word that we try to avoid, if they're actually now falling down to the ground, and that's happening more frequently. Falling is not something that is normal. It's not a normal part of aging. That usually means there's something going on. We hopefully would not let it get to that point, but if you start seeing losses of balance, decline in their normal functional mobility, whatever that is for that person, it's probably your sign to check in with the doctor and say, I've noticed these differences. They used to be able to do this, and now, they're not able to do this as much, or they need help with this now. Don't wait. What I always tell people is don't wait until you're already falling down to the ground to get help.
Right, for sure. And I'm speaking from personal experience again when I ask this next question, and I know the answer to it when it say the question is how important it is to where, as a physical therapist, you give your patients homework to do, because they just can't come into your 35, 45-minute session and
Mhm.
think it's a Band-Aid and you guys healed them, right? So you guys
Mhm.
give them in-home exercise and say, hey, take this at home. I'm going to print this out and continue to do it. I know my
Mhm.
therapist gave it to me. I was like, man, I'm not doing that. I feel good when I left that appointment. You guys already beat me up for those 30 minutes, right? A lot of patients don't do the in-home exercises consistently outside of the
Yeah.
clinic.
So this is the most important thing with outpatient physical therapy is consistency, frequencies. Outpatient physical therapy, we are trying to move towards what's a more patient-led, patient-centered type of interventions where the onus is on you. I cannot go home with you. I am an outpatient physical therapist. You will see me one, maybe two times a week. That is 1 to 2 hours a week. That is not enough to really make a significant difference. My job as a therapist is to show you what your impairments are and how you can help to either correct or compensate those things. And it's up to you as the patient or the client to take that information, to take that education home and implement that, and then you come back to me and tell me what's working, what's not working, and then we try to troubleshoot that again as well. It is not necessarily you come into the session and I fix you up kind of a thing. It is more about what you as the patient does, which is why that homework or the home exercises or whatever it is that we're giving you, that is the important thing to take away from physical therapy, especially as an outpatient.
For sure. So with my caregivers, I try to align it with my clients. If they have home health, you spoke on home health, that's true. They bring in their own PT through their insurance. So they have home health insurance. So they come out there with a home health company. And so I try to schedule a caregiver there to learn those exercises. So when that PT is not there, the caregiver can learn those exercises and implement it with the client, right?
Yes. Yes, that's
But
100. So that is something that we will do as physical therapists as well too. If we know that you have a caregiver or maybe your partner is your caregiver, that we will do caregiver training because yes, we understand that not everything we give you is going to be something you're able to do independently. And that is 100%. Like I said, I see patients through the entire spectrum of their disorder. So they're going to be at different levels. So yeah, having a caregiver there to come with you to your sessions, if possible, to see what physical therapists are giving you so that you can carry that over at home. Because ultimately, that is the goal of physical therapy is that we can give you things that you can work on at home and try to help yourself. But we understand that not everyone knows where to start or what things to do. And that's where we come in. But you have to implement those
yes,
things.
and no one want to listen to their significant other, right? You could be a physical therapist and have a significant other, but nobody want to listen to their significant other. So best to me, what I have found is the third party person, whether it's that
Yeah.
caregiver, whether it's that professional. Because you get home, you get back
Yeah.
into your routine, you get back into your comfortable setting, like, what do you know?
Yeah.
Yes.
Yep.
So understand that.
That definitely a big thing that we see as well too. That's why we say it is definitely important that if you have that caregiver that is able to assist you with those things too, they can kind of be that buffer and then they're at least another eye that is seeing what you're supposed to be doing in physical therapy to help you do that at home as well.
For sure. And that's why I try to tell clients, I said, remain the daughter, let us be the middle person to take care
Yeah.
of mom, dad, or whoever. Is there any new
Mhm.
technologies or treatments that you're excited about in your field?
So, yeah, there's always new things coming out. I would say I mean, it's still same thing, depends on the diagnosis, but in general, people are living longer and hence why people want to stay in their homes longer. Having something like caregivers can help with that so that they don't end up in a nursing home. One of the things that we as therapists have started to utilize in our own practice is the use of mechanical equipment to help people transfer from one place to another. I don't know if you can tell, but I'm not the biggest person here. It is not my job, nor your caregiver's job, to manually lift that person up and put
Body
them.
weight, right?
It's not a safe thing for the patient. It's not a safe thing for that caregiver or for the therapist, too. So even in practice, we've actually begun to use a lot more mechanical equipment, and a lot of insurances are now starting to go towards paying for some of those equipment to also be put into the home if we can justify it medically. So I would definitely say the use of mechanical lifts and different transfer devices. For some patients, depending on their diagnosis, we have electrical stimulating units that can help with things like a foot drop, to where after a stroke or after some sort of other nerve injury, you may lose the ability to bring your foot up when you walk, and you may be at risk for tripping or falling. And so now there's been a lot of new technology that's come out to have electrical stimulating devices that are wearable that will actually help to pull your foot up for you and to help to keep your muscles stimulating to kind of help you do that work. So those are other things that we're working with here in the neurologic physical therapy field.
Hey, you guys having a big impact. You're doing a lot of great community work. Appreciate you. We salute you on behalf of the veterans as well. You've been in the game, what, about 13, 15 years?
13 years,
13
yes.
years. So what's the most rewarding part of your journey?
I would say for sure keeping people in their homes, allowing people to stay independent enough to be able to stay at home is the most important thing that I can do. And it's the most rewarding for me to have somebody say, "Thank you so much. I'm able to do this on my own." I had a patient the other day tell me that they were able to go to their grandson's graduation. They didn't think they were going to be able to do that. Or another patient who was able to attend his son's soccer game when before he wasn't sure that he would be able to do something like that. Just allowing people to still be able to live their lives. We take for granted like these everyday things that we do, to being able to get up and walk from one room to the next, being able to get out of the house and go to these milestone events. For some people living with neurologic conditions, those things are not possible, or they're severely limited in it. And so I would say being able to help them continue to do those things is the most rewarding.
Can you share a story with a patient that's still stuck with you? It's like ingrained in your heart, like that one success story. Do you have one?
I do. I mean, I have a couple, but I do have one that definitely sticks out to me. Older gentleman, very dedicated daughter slash caregiver, came to my outpatient clinic on a gurney because he was not able to even tolerate sitting up in a wheelchair. He was very motivated, and he had the family assistance to follow through with all of my recommendations. And within 3 months of him coming in on a gurney, he was able to walk with a walker, not all the time, but he was able to walk with a walker in his home, which is something he hadn't done in 2 years. He told me he hadn't walked in 2 years.
That's the doctor of physical therapy, T. Washington effect, right?
Well, I mean, it's not just me. It is a team. It is a team effort. It is not just what the physical therapist does. It is that patient as well, too. The patient and the family, they follow through with everything I recommended, and he improved.
Right. So while we have you here, and thank you for the time again, we're blessed. How can a family caregiver in my office, my agency, my caregivers, how can they more support a client or a family member going through a neurologic journey? How can they better support them? They go into their physical therapy sessions and
Mhm.
they ease their pain or their path at home.
I mean, I would
Besides
say
the
the big
exercising, is there any other way they could take them through a journey through their rehab to make it a little bit lighter? Because it's a challenge, right? Somebody who's going through this journey, who's going to rehab, there's
Mhm.
neurologic problem, and the family is stressed because it's something that's called respite care that these families are getting drained as well, right? So do you have any advice for my caregivers, those family caregivers, or anyone that may be going through a situation?
I tell all of the families or the caregivers, continue to be as supportive and empathetic as possible. It's hard for us to put ourselves in other people's shoes when we're not necessarily going through it, and just trying to continuously motivate that patient or that client to continue the journey. I cannot always promise that things are going to get better, but at least we want to maintain what you have. And for that, we need a full team and we need you to be consistent. We need everyone to be on the same page and be supportive.
What is one myth or misconception regarding the neurologic physical therapy that you wish people could understand more about?
Well, I would say we already touched on it a little bit, is that, physical therapy, the physical therapist is going to cure you, kind of a thing that, you're going to come into therapy and being there is going to fix it. I mean, if I had magic physical therapy dust that I could sprinkle on, then that would be great. If I could cure you just by doing these interventions, I should get paid a lot more. But no, that's not the reality of how these things work. Like I said, we're a team. I'm here to show you what your impairments are, give you the strategies to help to improve them, and it's your job to implement those. And so, yeah, trying to tailor people's expectations when they think that, oh, if I just come in and do therapy, like you're going to get me better. Nope, you're going to get you better.
So where can I find some of that physical therapy dust?
Neverland.
Never. Right. And so to finish it up, I appreciate you coming on today. Where can people find more information, or if you're willing, how can they get in touch with you?
Oh, with me. Well, so with me personally, you would have to be a veteran technically, because for right now, I only exclusively work for the VA hospital in Long Beach. So if you are a veteran, then yes, technically you can always ask for a transfer of care to Long Beach VA and ask to be assessed by a physical therapist.
Right.
Any physician can put in a referral.
Is there any social media platforms you on that can reach out to you if they have more questions, or you like, nope, this is it. This is all they
checked. I don't have a professional page, unfortunately.
Okay. Well, thank you, T. Washington. I appreciate your time today. Everybody else, if you need more questions or if you have more concerns regarding this matter, please call our office. Our phone number is 562-213-9137. Goodbye.